November is Lung Cancer Awareness Month, and I have two guests with me this morning here on Jersey Magazine. Andreia Lima, who is the CEO of ImageCare, and Luchy Jerome, who is the lead CT technologist for ImageCare Centers. Welcome to both of you here on Jersey Magazine. Luchy, let me start with you. I know that lung cancer is the leading cause of cancer deaths worldwide. What are the different types of lung cancer?
Well, you're going to have small cell and large cell carcinomas that could be found in lung cancer.
And
And
what's
in
the
the US, I just want to add that every 2.5 minutes, someone gets diagnosed with lung cancer. So it is a prevalent cancer.
Lucci, what happens during a lung screening?
Very simple, actually. Patients come in, they're there for about 10 minutes tops. They come in and they have to go through a little questionnaire, try to get a little bit of a history with the patient, try to see, we ask how many years have they smoked for, how many packs a day they smoke. Once we get that established, they lay that on the table. We go through a quick scan, 2 minutes for the scan, and then they get to go home.
Are people generally nervous when they go in?
Sometimes. With these lung screenings, majority of the time they're coming back in for follow-ups. So they're very familiar with the process.
Who should consider getting their lungs screened? And that's probably a
So
very general question, probably
it
everybody,
is,
but in
no,
terms of
that's a great question because not everyone qualifies for a CT lung screening. So you do have to qualify with some metrics. You have to be between the age of 50 and 80 years old. You have to smoke a pack a day, I believe, for 15 years or more. And if you have radon exposure, also you qualify for a CT lung screening as long as it's long term.
now, I'm in my late
Anything?
60s. I'm
Okay.
reasonably healthy. I haven't smoked a cigarette in well over 30 years. There's no history of lung cancer. There's cancer history in my family, but not lung cancer. Am I a candidate for a screening?
You'd have to speak with your primary, but given that you stopped smoking over 15 years ago, it would really depend on your primary's take on that. He may say, hey, just to be safe, have a CT lung screening, or because it's been over 15 years that you've quit, you might not qualify. Well, what's your take on that?
So I actually that's pretty much what it is. Your primary physician is going to be the one that's going to determine whether you qualify for it. And based off of whatever the history, that's what they're going to run with.
How often should someone get screened once they are determined that they're in this category?
So that one determines on the radiologist reading. So they will determine whether a patient needs to come back in a 12-month follow-up, a 6-month follow-up, or something sooner if something is seen during that scan.
Obviously, not starting smoking is one of the biggest things that people can do. But what are some of the other things that people can do in terms of preventing lung cancer?
Well, definitely, like you said, don't pick up the cigarettes. Try to avoid smoking or even secondhand smoke. You want to be aware of your surroundings. And I mentioned radon exposure because, that's also a factor. So be aware of your environment, make sure you're in a safe space, and get your routine screenings. If you are a candidate for the screening, it's because you have been exposed to the categories that would qualify. So it's best not to be around them in the first place.
And Andrea, for our listeners who want to learn more about this, where can they go?
They can go on our website, imagecarecenters.com, and they can also Google a bunch of information on the CDC website. I would recommend that as well, has a great source.
And again, that is imagecarecenters.com. There are numerous locations throughout New Jersey. Andrea Lima and Luchy Jerome from Image Care Centers, thank you so much for your time this morning here on Jersey Magazine.
Thank
Thanks.
you.